Hello, Namaskaram. Myself, Dr. Chakradhar Pedada, consultant cardiologist, Apollo Hospitals, Visakhapatnam. So the reason why I came before you is to enlighten you about this 29th September, which is celebrated as the World Heart Day every year. So the theme of the World Heart Day this year is use heart for every heart. So why we celebrate this World Heart Day every year? It is just to create an awareness about the cardiovascular diseases that is prevalent in the entire world. So if you take the statistics, around 18 million people are being affected with cardiovascular diseases, that is heart related problems every year, and which are if you take around 31% of fatalities in the entire world. If you take these cardiovascular disease accounts for around 31% of the fatalities. So to create an awareness, the thing is why these days, if you follow the social media, the news, many celebrities and many younger individuals are getting these heart-related issues, heart attacks. So why this heart attack is happening in the younger individuals? So especially the reasons behind this is in sedentary lifestyle and eating at an irregular intervals, eating and it's not a high caloric diet. All these factors along with the risk factors. So these are all the modifiable factors, and also some risk factors are there. So the reasons for this young myocardial infarction or young heart attack. So like I discussed, diabetes, hypertension, dyslipidemia, that is high cholesterol levels, family history of heart disease, and the most these days, this because of the sedentary lifestyle and eating improper food and at an improper time, junk food and high caloric diet. So all these factors causes heart related issues. So how did it start? Actually, it starts as a plaque deposition. So we call it as a coronary atherosclerosis. So it is a slow process, and these days, if you take it starts even in the younger individuals at an younger age, even in the 20s, 30s, it starts at an young age, and over a period of time, it slowly progresses. So coronary atherosclerosis is a slow process and it is a continuous process. So when once it reaches a particular stage, when once the plaque ruptures, the plaque erosion, so it creates a heart attack. So once the plaque ruptures, the entire clotting system activates and then it causes a heart attack. So to prevent a heart attack, so to prevent all these things, so it requires an awareness about regular health checkups about your heart. So at regular intervals, you have to check the preventive health checkups. You have to take the preventive health checkups to know what are all the things are there. Like you have to check your sugar levels, your BP levels, your cholesterol levels, and for a healthy heart, you can check your ECG, echocardiogram, and treadmill test. This is a stress test, treadmill test, and also recently we got a coronary calcium scoring, with which we can know the exact amount of the deposition, the plaque deposition, how much calcium is there inside the blood vessels that supplies the heart. So depending on if an excess amount of cholesterol deposition there, even once it exceeds a certain level, like a CT calcium scoring, we can start them on anti-cholesterol medications, that is the statins, the lipid lowering drugs. We can start them on the statins. Also, these diabetics, especially more than 40 years of age, and diabetic people, they also should have been on the cholesterol medications. So all these factors, if you consult your local doctor, a cardiologist, he can enlighten you on what are all the preventive measures that you can take, like whatever I discussed now. Regular health checkups, and you can monitor all the blood. You can monitor all the blood levels, your cholesterol levels, your sugar levels, and you monitor your BP levels. And also, once you get done all these tests, your specialist doctor can advise you what are all other preventive measures you can take so that you can prevent a heart attack. Thank you.